Welcome back to another episode of Connecting Pathways. In the previous episode, we've been discussing on post-traumatic stress disorder among children, their symptoms and causes. In this episode, we'll be discussing on the diagnosis of PTSD, the treatment, and some of the ways to help children with PTSD. Not every child or teen who goes through trauma gets PTSD. PTSD is diagnosed only if the symptoms keeps happening for more than 1 month and it negatively affects the child's life and how they function. For those with PTSD, symptoms most often start within 3 months after a traumatic event. But they can also start months or years later. A child psychiatrist or a mental health expert can diagnose PTSD. They will do mental health evaluation. A child must have witnessed, heard about, or been a part of upsetting event or dangerous event to be diagnosed with PTSD. They must then display extreme signs of anxiety. These signs are categorized into 3 groups, which are contemplating, dreaming about, or enacting the event, feeling numb, having trouble concentrating, and having trouble connecting with others, being easily irritated, fearful, or having trouble sleeping. After the event, the symptoms must last at least a few months. That's because it's natural for a child to be upset after a traumatic event. Treatment will depend on your child's age, general health, and symptoms. It will also depend on how severe the condition is. PTSD can be treated. Early diagnosis and treatment is very important. It can ease symptoms and enhance your child's normal development. It can also improve your child's quality of life. Treatment may include cognitive behavioral therapies, in which a child learns skills to handle his or her anxiety and to master the situation that led to PTSD. Trauma-focused psychotherapy models. Varied trauma-focused psychotherapy models emphasize components and/or have been customized to treat patients with specific characteristics, clinical presentations, or certain settings. Next is EMDR therapy, which stands for eye movement desensitization and reprocessing therapy. It can foster resiliency and increase self-esteem in children while creating an adaptive cognitive and physical shift. This therapy can help a child's negative thoughts about themselves and the world to transition into healthier beliefs by focusing on the present moment. Play therapy can be used in young children with PTSD who are not able to deal with the trauma more directly. The therapist uses games, drawings, and more interesting techniques to help the children process these traumatic memories. The medications used are selective serotonin reuptake inhibitors, which is SSRIs, are approved for use in adults with PTSD. SSRIs are approved for use in children and adolescents who are having depression and OCD. Preliminary evidence suggests that SSRIs may be effective in treating PTSD. However, there may also be risks such as irritability, poor sleep, and inattention. Specialized interventions may be necessary for children who are exhibiting particularly problematic symptoms or problematic behaviors, such as inappropriate sexual behaviors, extreme behavioral problems, or substance abuse. Let's see some of the tips to help children with PTSD. First, identify trauma triggers. Your actions, words, or even an item in your home may trigger traumatic memories. Pay attention to what distracts or scares your child, or emotions that doesn't seem to fit a situation. Next, stay present. Offer encouragement, reassurance, and attention in whatever way your child needs at the moment. If they want to talk about their experience, be available to listen. Control your emotions. When your child escalates, remain calm, lower your voice, and listen to them. Don't take their behavior personally or use physical punishments. Fourth, create consistency. Regular routines are vital to help children feel stable and secure. Last, encourage and empower them. Create positive experience to boost self-esteem. Teach relaxation techniques such as breathing and allow age-appropriate choices to help your child feel in control. With this, we have come to an end of this episode on post-traumatic stress disorder among children. We hope to see you on our next episode of Connecting Pathways. Thank you and stay tuned.